AM 1300 WMEL.
The views expressed on the following program are those of the hosts, callers, and guests, and are not necessarily those of WMEL staff, management, or advertisers.
Joe Steckler, host for Helping Seniors, the radio arm of Helping Seniors of Brevard County. Our program is all about education, information, and connecting seniors and those that care for seniors to resources. I have a two-part show today, but before I get into it, I'd just like to remind you that the phone number at the office is 473-7770, and that's you get hold of Kay, our information specialist. And she's with me here in the studio today, and also the radio number here for the radio station. If you have a question today and you want to call us, and please, don't be bashful about calling. You don't have to mention your name. If you want to call 631-1300, 631-1300. I think from this, I want you to always have a pencil and paper ready because I think sometimes we give some phone numbers and some information that you really might want to refer to later. So try to think about doing that when we start our show. Sponsors for the first part of the show include Gentiva Home Health Care, the Eye Institute, Solid Bite Dental Implants, and we have a guest doctor from dentist from Solid Bite with us today, and I'll introduce him later. Bill Johnson, elder law attorney, WMEL radio station, AM 1300, this radio station. Woodstock Hospital Systems, Levin Home Care, Ren Care, which is a medical alert button system that you wear, Atlantic Shores Rehabilitation, and the Social Club, which is an adult day care. Folks, and it's just a brand new one, opened up down at 5200 Babcock Street in Palm Bay. And if you want to take a look at something new and innovative in adult daycare, I highly recommend it. You give the Social Club a phone call, and I've got that phone number here. I'll give it to you right now. No, I told you. No, I've got it. Here it is. The phone number is 373-7000. 373-7000. And I'll mention our newest sponsor is Ebony News Today. Ebony News Today. It's fifth version of 25,000, and our first column and the survey for our advocacy program will be in their issue that'll be distributed to the newsstands tomorrow. Tomorrow will be our first column in Ebony News Today. So that's all the commercial type stuff, folks, today. And now we'll get to the first half of the show. You on there, Dr. Furtado?
Hello, Joe.
Hi.
How are you? So,
folks, we're going with our plan for the day. The first half of the show is Dr. Michele Furtado. And the reason it's Michele is French, right, Doctor?
Yeah, Michele, it's a French name, but I'm originally from Brazil.
Oh, I know. But they have Frenchmen down there in Brazil, too.
They do have some, yeah.
The important thing, though, Dr. Furtado, is the fact that you bring a new look at periodontal care here to Brevard County. And I know Dr. Sheldon's been here a long time, and he's been on this radio show and our TV shows and written in our newspaper columns for many, many, many years. But you bring a lot of new things to the practice of periodontal care. Am I right in making that assumption?
I hope so. I try to add as much as I can, and of course I have giant shoes to fill with Dr. Sheldon being such an involved periodontist in the community. So I hope I'm helping, and I hope someday be as involved as he is.
Well, you sent me some questions, and I think since. And Dr. Sheldon and I talked about this, and a lot of our listeners probably are not as aware of the connection between gum disease and other diseases in the body, and especially heart patients.
Yes.
Can you do some enlightening of our listening audience about the importance of periodontal care and making these connections, Doctor?
Yeah, absolutely. What we have seen lately with in the periodontal science mainly, and some of the other medical fields, there is evidence of the link between gum disease and other chronic inflammatory diseases. So for those who don't know what gum disease is, this is a chronic degenerative inflammatory disease, which means it's a slow-progressing inflammation that your body has as a result of an infection. And that destroys all the tissues around your teeth. But that doesn't stop in the mouth. Your mouth is connected to the rest of the body. So that represents a burden to your body. And that affects your ability, and there's studies to show that affects your ability to maintain, for instance, your glucose levels, your blood sugar levels. So it was shown that in people that have gum disease, they're more prone to have diabetes. And there's also evidence that people that are diabetic, for instance, have more gum disease. So they call this the bidirectional link. In terms of heart disease, and again, we're talking about chronic degenerative diseases, chronic inflammatory diseases, heart disease, diabetes, and others that we can go. There's a big list like chronic kidney disease. So you mentioned heart disease. There's been some studies that show that bacteria that can only be found in the mouth and under the gums, they found some of those bugs in heart tissue. What does that tell you is that bacteria that are in your mouth travel your body and may get stuck in some other places. There's been a link between preterm low weight birth and gum disease, because some of the bacteria that can only be found in your mouth were found in the placenta. So what we thought was something confined to the oral cavity is now shown to affect your whole body.
Okay, let me ask you a question then, Doctor. As a just hold what you're thinking about periodontal disease and gum disease and the spread of infection to the body, and let's take it to a case and see if you can compare or show how important or we might be suppressing diseases in our body through our mouth if we don't treat it correctly. And here's what I'm thinking. Mm-hmm. I had a back operation. I had some terrible pains in my hip. I mean, really bad. I went to the doctors. I asked if I had an infection. They said no. Mm-hmm. I go to my cardiologist. My cardiologist, for some reason, picked up something. So he sent me to Worcester. They did a 2-day culture. Turned out, I had a heck of an infection in my body. It was killing me. Yep. So they put a pick in my arm, and they treated me. That's after I got out of the hospital for 5 days. They treated me for 7 weeks with a daily... a
drip?
Yeah, a drip. And then I had that problem. Then I had a friend of mine that had a hip replacement, and it just didn't heal, and he was in agony. So he goes back to the doctor, and it's the same thing, an infection. So they put a pick in his arm. So they do another 6 weeks of these treatments. Can that same type of parallel connection be made between failure to understand the importance of periodontal care and what disease can do to the body, and can that same type of infection spread through the gums, Doctor?
Yeah, absolutely. You know, one of the biggest problems we have with chronic inflammatory diseases is that most of them don't hurt. So you have an infection in your mouth that you don't feel anything, so you think, well, it's not broken, let's not fix it. But you do have an infection, and then you go to have an operation. But you have bugs traveling through your system, and then that's a possibility for the bugs to get there where you had an operation and have an infection. But you didn't know you had an infection in your mouth before because it doesn't hurt. So our body is constantly trying to fight these infections or this inflammatory reactions without you knowing, unless you go to the periodontist every 6 months or to your dentist every 6 months, and then we try to control that. But that may be a big link between any type of surgery or operation that you have, and if you have an infection and you don't know you have gum disease, there may be a link there. As a matter of fact, there's a big debate in the literature or in between specialists in regards to if you should give antibiotics or not for patients that have hip replacement and knee replacement, and that changes every 5 years. There's no consensus on if you should take antibiotics before having dental procedures or not.
You know,
we go back and forth.
What you're saying, actually, Dr. Furtado, should actually frighten people. And I don't mean that in a derogatory way, because I know that the pain in my back and the pain in this man's hip, these pains darn near tore us apart. But if we don't experience that same kind of a disease, a problem or a pain with periodontal disease, yet it can do the same thing to the body, it makes it even more important that we pay more attention to what a periodontist can do for us, and need for people to get periodontal care the same as we go get a tooth filled or go get our teeth cleaned. And we don't do that, do we?
It's rare that people would look for prevention, I think, in all aspects of medicine, Joe. And I cannot emphasize enough how important prevention is. And people may think, oh, you want to do surgeries, you want to do your procedures, you want to be a periodontist, and you want to cut people, and you want to place implant. But I always tell my patients that I'd much rather see them healthy and follow up with them in the prevention chair, where the hygienist is, and I can do my measurements and see that they are healthy, than having to do surgery. But people seem to be afraid. You're right. They seem to be afraid either to find something or they think everything is fine.
Yeah.
So I cannot emphasize enough how prevention plays a big role.
You use the word prevention. I want to let you talk just a little bit about prevention, but I want to ask you a question about implants. So go ahead, quickly tell people what you think are some of the things that they should be doing for prevention in terms of periodontal care.
Well, first off, you have to see a dentist at least twice a year, once or twice a year. If you are diagnosed with gum disease, then it becomes a different game, because the cure for the disease is not there yet. So it's just like diabetes. You may have high sugar in your blood, and you don't feel anything, and you go to the doctor and they diagnose you, and you have to start, getting into a diet, exercising, and sometimes taking medication. With gum disease is the same thing. If you're diagnosed with gum disease, then your visits to the office may be more often. You may need to be seen 4 times a year for regular checkups and cleanings. That is if you don't need surgery to stabilize the disease. So in this case, what we are doing is not preventing gum disease, we are controlling gum disease.
But let's say a person goes through all that, though, and they get to the point where, we got 32 teeth, and if they pull all these, I think a lot of people are under the misassumption, and I'm sorry, we're only going to do a half-hour show. I'm going to get you back on next month to finish this discussion, though, Doctor. But
sure.
Let's say people thinking you got 32 teeth, but pull all those teeth for disease or because you need dentures. And we talk about implants. People think, well, if I pull 32 teeth, I got to put 32 implants in it. And that's one of the most misunderstood things in the world. And I didn't realize that until I started reading Dr. Sheldon's reprint of the Ultimate Mouth Manual that we could get by with 4 to 8 implants, and I made the assumption that was 4 implants for lowers and 4 implants for uppers to anchor the new dentures. Is that correct?
Yeah, you can range from 4 to 8. That depends on the patient. So if you have a strong bite, if we have to recreate the whole bite, sometimes we need more implants for support, and the more spread out they are, the more stability they offer to the denture. So you don't need an implant per tooth if you lose all the teeth. But just going back to gum disease, and patients some patients believe that they have gum disease. If they take their teeth out, they're free of the disease. And that's not true, because you can also get gum disease and bone disease around implants. So it is a patient-related disease, not a tooth-related disease. It has a lot to do with the patient's genetics. It has a lot to do with the patient diet. It has a lot to do with the ability of the immune system of the patient to fight infections. So it's not taking the teeth out is not an option. It's not an alternative to. It's not a cure for the disease. You're not free from it. But in terms of dental implants, yes, you can replace a full set of teeth, upper and lower, with a range of 4 to 8 implants. We usually do from 4 to 6 because with the new technologies, with the better implant surfaces, implant designs today, and with our ability to identify places in the mouth where we have enough bone, we can spread 5 to 6 implants and then stabilize the denture in the same day.
Well, Dr. Furtado, I have 3 implants, and I know when Dr. Sheldon put my 3 implants in and and I had the false teeth put in on my lower left jaw, I feel just as though they're my original teeth. And I go back and I think of people that came down from Virginia 20 years ago that went to Dr. Sheldon. It dates him a little bit. They went to Dr. Sheldon, and he did a lot of implant work on this one person, and she never had a problem with her teeth. She really loved the work he did. So, yeah. My feeling is it's just like whether you want to buy a Rolls Royce or buy a Buick. Me, I'm looking at a Mustang, and my wife is upset because I haven't made up my mind between the red and the ruby red and the yellow. And I like the black interior, and she thinks that's going to be too hot. But I get my second childhood, and I think I really want to have that Mustang. But at the same time, I think we need to think more about what the heck we put in our mouth.
Yeah.
We could do a lot better, and if we had to replace our teeth, and I think about bite, think about chewing, think about how my teeth work together. If I had dentures in there that were anchored by implants, it seems to me that's a heck of a lot better way to go than by using glue to glue my teeth and my gums.
You're absolutely right. With the new the modern implants now that's from 1982 from today. Implants came a long way, and they offer a fixed option for the patient. So they are anchored in the bone. You put a tooth on top of that. You don't have to take in and out. And also, your jaw bone, responds to touch, to pressure, to constant low-grade pressure, which means it's building bone around that implant. And so you're keeping that bone in there, as opposed to when you have a partial denture or a denture. That denture is sitting on top of your gums, which is transmitting the forces to the underlying bone, and that bone is not going to respond well. It's going to just resorb away. It's going to dissolve. So that's why a lot of people complain about dentures that get loose with time, because they become wiggly because there's no more support for them.
Wow. We're almost out of time, Dr. Furtado, but how about we do this? We're going to be taping our television show on the 29th of May. Mm-hmm. I would like to continue this discussion on a 26.5-minute DVD so people can really see what you're talking about, Dave. Is that a deal?
That's a deal.
That's a deal.
My pleasure.
Okay, thank you, Dr. Furtado, for being with us. And stay with us, folks, for after the break, and Kay will be back on. We'll talk about the advocacy. Thank you, Dr. Furtado, and say hello for me. Bye-bye.
It's been a great pleasure. Thank you. Bye.
AM 1300 WMEL.
This is Joe Steckler, folks, back live with the second half of Helping Seniors. And I want to thank again Dr. Michele Furtado from Solid Bite Dental Implants for that wonderful discussion about periodontal care, gum disease, and we did that, folks, so that more of us can get a better appreciation for what infection does in our body. Too often we ignore things that are telling us that we need to go to the emergency room, or we need to go to our primary care doctor, or we need to take some kind of positive action. And that's one of the reasons why we started helping seniors. We believed, our board believed, that there wasn't enough positive action being done here in Brevard County to support seniors. Now, I'm not talking about taking care of seniors. I'm not talking about giving you a pile of money. That's not what I'm talking about. I'm talking about making sure that we had the services, the information, the referral network available to get the job done. And that's what we're trying to do. That phone number for Kay at the office is 473-7770. And my sponsors for the second half of the show include Senior Scene Magazine. If you haven't read it, folks, the new issue's out now on the newsstand.
It has been out.
Yeah. Pick it up. Spotlight Magazine, Seniors Helping Seniors, The Fountains of Melbourne. Beth Courtney Braswell Financial Advisors, Kennemuth Chiropractic, Canadian Medications, Wiedemann Malik Attorneys, Vitas Hospice, and the latest is Peaceful Beach Mediation, and that's attorney Brooke Goldfarb. And I used to work with Brooke's father, Tim Deratani, many years ago at Florida Institute of Technology when I retired from the Navy. And Brooke is trying to set a meeting up between herself, me, and Jack Levine. And Jack is from Tallahassee, and he's been long involved in senior and elder care. He's highly respected. So he wants to do something down here, and he thinks Melbourne would be a good place to do it. So we've got a three-way discussion. I'm going to include Kay on it when we're going to talk to them about maybe bring some new information to the people in Brevard County. And that's why I think that you always need that pencil and paper, because I had a book, a pamphlet open here on the tray here at the radio station, and Kay said, Joe, I called those people yesterday. I talked to Mary. And Mary is the lady, folks, over at My Access, and they deal with Medicaid issues. And after I did my radio show last week, I tried to call the agency I tried to call the Elder Helpline. And I called the Elder Helpline, and I was under 33 minutes and never got an answer. Now, to short-circuit that, you could go over to My Access and talk to Mary. She'll tell you exactly what to do. If you've got a problem when you talk to the Elder Helpline, call Mary, and here's her number, 373-0824. 373-0824. Not only will she talk to you in person, she's a heck of a nice, personable lady. And that's a heck of a lot better than talking to that stupid telephone sometimes that you can't get anybody to answer you on the other end of the line. Am I upset about it? Yes, I am upset about it, folks, because if I have that kind of a problem in getting through the system, I become more aware of the problems that you have. And that's what Kay and I are going to talk about today. And go ahead, Kay.
Joe, I want to bring out to the listening audience, too, that the access number that you just gave, if you cannot find it or anything, don't hesitate to call me at the office. I keep a lot of these brochures on hand at 473-7770. But our access also, because I've sent a lot of people over there when I've discovered that they are wanting to apply for food stamps. That's another service they offer. And temporary cash assistance, clothing assistance, medical service assistance, even marriage and family counseling. So it's not just the Medicaid, although that's pretty much the strength of it, but they do help with other services too.
But you also bring out something, and I don't know if any of you listeners have experienced what Kay has picked up through calls to the office, and that has to do with the reduction of the amount of money people are receiving through food stamps. Have you gotten any more information on that, Kay?
Yeah, there's so many different parts in that it's based on an individual basis, because of, it's not just the income, there's how much, they're paying for rent. They've taken a lot of different in consideration. So it's just like our fellow that we helped get dentures for. He was getting much more in food stamps than the majority of the people. So with the combined income, probably, looking at $765 a month, that's not enough to buy food.
And I've had it said to me over point blank to my face, folks, over the last several weeks that helping seniors is not a needed service. That other organizations in Brevard County do what we do, and they're familiar with doing what we're doing. I don't believe that, and I don't believe it for a number of reasons. Primarily because no one does. It's just not true. But Kay, what are some of the things that you're getting that would support my theory that helping seniors is a needed service and that it does not duplicate what is? What are some of the things you as an information specialist
absolutely
get?
Well, when I get a call and I give them a couple resources, the one thing that I tell them is I said, would you do me a favor and please call me back and let me know how things work out for you? And they said, yes, I will. 90% of those people do. And those other people that don't call back, I'm going to follow up and call them. I mean, I've been working and calling people since last August, even at this point, just to say, hi, how are you? How are things working out and everything? So I'm more of I want to say case management. And they're getting all this for free. There's no charge to any of our callers calling in. But unlike just saying, okay, here, call this number, that's it, goodbye, have a great day. We don't work like that, Joe. And like we say, you formed this organization to try to help educate and provide a provision where people can go and they're going to be respectfully treated, because so many of our seniors sometimes, quite frankly, just need somebody to talk to. They're all alone. They don't have family nearby, and they just want to have someone that will listen to them.
So many times, Kay, I get people who call me, and I tried to call a gentleman this morning. His father is 93, a World War II veteran. He's incontinent.
And a general.
He's incontinent. He needs placement in a nursing home. He has Parkinson's and dementia associated, like Lewy body, with Parkinson. And he's been taking care of his father by himself for 5 years.
Right.
And, he's at wit's end. And I got a phone call from a home health care agency and asked me what they should do. Mm-hmm. And I said, you and I talked about it, and because you asked the lady to call me.
That's actually how the whole thing started. The son called us.
Oh, he did?
Yeah, that's how the whole thing originated.
I didn't know that.
Yes.
But through a process of phone calls, I talked to a pretty senior person in the VA, and I said, hey, look, we could escalate this thing to all kinds of things. I could go to Congressman Posey. We could do all this. But that's not going to solve the problem where that man needs help now.
Right.
So he said, Joe, I agree with you. Let me make some phone calls. And he did. I'm sure he did, because this gentleman now has a meeting with a clinical director in Orlando tomorrow.
Yay.
To discuss his father's care. And there's a beautiful VA nursing home over at Lake Nona. Mm-hmm. I think that's over towards Tampa.
Right. I believe so.
Yeah. And the problem was they needed a bed. And in the meantime, this poor guy was in, I'm not going to mention names, but he was in a local nursing home. Mm-hmm. And the local nursing home simply did not want what the VA rate was, which is close to a Medicaid rate. He didn't want that for the bed because they could get a more expensive Medicare rate.
Right.
So what they did was say the guy had a heart problem, transferred him to the darn hospital.
Right.
And the hospital, you got on the phone with the son and said, get him out of the hospital, get him back in a nursing home so they can't throw him out. Got back there?
Exactly. He was
released.
What did they find
when he got
fine.
Back? What did they find?
He was fine.
No, but they were already cleaning his room out.
Oh, yeah, that's right.
Yeah.
And now there may be a chance that he may not have a bed at Lake Nona. So, it's just, when we start talking about the things that are going on with people being shifted from point A to point B without getting into all the detail of that again, Joe, It just people are reaching out, and it's lack of, where do I go? Who do I turn to?
Yep.
And here, this original call came in. I put him in touch with a nurse registry. This lady has been in touch with him on a continual basis to help, and she actually did help, with the father and everything. And it's just not right, when you need to, when you visit a nursing home, don't go at the same time. Change it around a little bit. Because now what's even been discovered is that the lack of really attention, he may have some bed sore.
Right. What Kay and I are talking about, folks, is that, you can't solve every problem. But in most cases, if the problem is presented the right way, you got a better chance of solving it. And the reason I was trying to get a hold of the general, it's a major general, folks, served in World War II. The reason that I was trying to get a hold of the son, because I happen to know that the son is very angry. And anger is not going to solve the problem when he talks to the clinical director.
Right.
It might, but I don't think so. Most often, cool heads prevail. And I think that's what we're finding in our advocacy group. Kate, would you like to give our listeners just a little update? And just name two of the things that you're picking up. And folks, we've probably gotten 250 to 300 surveys back so far now. And
plus, they're still available to be taken on our website, helpingseniors.brevard.org. So
right, and it's going to be in Ebony News today, tomorrow.
Yes, that's what he said. Right.
And it's in Senior Scene.
Not in this month.
Not this month.
But anybody can go to our website, helpingseniors.brevard.org, and you can take it online, and you have the opportunity to put your comments in there as well, too.
And I'll ask you, one of the things we're trying to do, folks, is be cost effective in what we do. So those of you who take the survey, if you want, and I encourage you to put your email address on there so that we can send you our newsletter on a monthly basis. And if you don't like what we send, all you got to do is tell us to stop, cease, and desist, and we will send it to you.
Right.
But if we can get more people, Kay, to let us use an actually inexpensive, no-cost way to get news to them,
right,
we all profit.
That's absolutely right.
Yeah.
And what just gets me hitting home is so many of the surveys coming back, Joe, are there's a lot of seniors, and I mentioned being lonely here again, and with the callers just wanting to have someone to speak to, but there's a lot of them are coming back. They don't have any family here. They're worrying about who's going to take care of them, who can look out after them. But affordable housing, lack of funds, just trying to stretch that dollar to get through to the end of the month. And it's a major, major thing because a lot of people really haven't talked or I hate to say it, Social Security doesn't cover too much, when you're looking at depending upon that and that only in a month.
Yep.
So,
well, you and I have talked about this, and based on what we were finding over at the advocacy group and all the survey results coming back, folks, I remember back in 1996, I participated in a United Way panel that talked about the. I got an article here. I'm trying to. You should have printed this bigger, okay? Because that's how I have a hard time. I can't see what I'm reading. But this.
Here we go. Since a huge number of United Way, county, state, and local charity dollars have been expended to this effort, meaning that trying to do with the survey and trying to get without. What progress have we made? Yeah,
in 1996, folks, we identified 18 areas of concern by all the civilians that participated in this thing over a 2-day period. And I started thinking about the comments that are coming back from the survey, and 12 of the 18 areas are still up in the air. Now, this was done in 1996, And the 12 areas included transportation, affordable housing, financial aid for emergencies, home health care, home maker services, emergency shelters, information and referral, and that's exactly what Helping Seniors does, respite care, primary health care, crisis intervention, and service and activity activation. And one of those comments was about loneliness. And Kay asked me, she said, what do you think we can do about that? I said, well, if we develop the advocacy plan, we put in where we're talking about information and education, we put in there that one of the strategies you need to help resolve this problem might be the development of a group of volunteers, 4, 5, 6 people from Titusville and Mecco, that would agree to be a phone caller to call this person from their house on 2 or 3 times a week, just to touch base with them, because that's what they call you for, Kay.
That's right. So many of the callers coming in, they just don't have anybody to talk to, and they're lonely. And gee, what's going to happen to me? I'm really here alone. But you're right, Joe. Wouldn't it be wonderful to have a group of volunteers to take and just say, hey, I'm going to call Mrs. Smith today. I haven't talked to her for a day or two, just to check on her and see how she's doing. And keep in mind, I recommend a lot of people, call Rick Wren. They're living alone. They certainly would it's certainly recommend that they get a medical alert, because, they do fall. What are they going to do? Who are they going to call? And I've heard stories over the years of women and men who have fallen, have not been discovered, and been lying on that floor for days.
Yeah. I remember years ago when I was called from Tallahassee and asked if we would put an application in to be one of the first of 2 Project AmeriCorps Elder Serve programs in the state of Florida. This was something started by President Clinton. I said, how in the world are we going to do that? And it was Department of Elder Affairs.
Right.
I said, we'll help you, Joe. I said, you help me, and if we get it, then we'll do something. We got it. We had it for 8 or 9, 10 years. But I remember that the people in that AmeriCorps team, there were roughly 20 of them, they used to find older people that needed a house painted or they needed yards cleaned up, and they would descend en masse over the weekend and paint a house or completely redo the yard. And there was no cost or anything. We got a phone call. You sent it to me, or I got it and I sent it to you. I said, let's see if we could solve it.
Right.
Meaning you solve it. But the woman was 98 years old. Her son...
76.
76. And he said, I can't paint the house, and the homeowners association wants the house painted, and she can't do it. She can't afford it.
Right.
So what we're looking for now, and I was going to talk about Kay about this after show. Well, we know some churches have youth groups that might just take this on as a project to refurbish the front of this lady's house. What I'm saying, folks, is that if we don't do a better job of trying to direct no cost, 0 cost assets to solving some of these problems, we'll never solve anything. And that's what my next article is going to be about. It's titled "The Realities of Aging."
Right.
And it's going to be in Hometown News, Spotlight Senior Scene, and Ebony News in the June issue.
Right. Well, and I invite people, if you just tuned in and heard the back end of this program, we had given a lot of numbers here initially at the beginning of the program, but please call me at 473-7770. Whatever it is that you're looking for, I know I can't help 100% of the people, but by golly, if I don't have the answer in front of me, I'm saying, let me get back with you and let me research this.
Well, I tell you, we're going to let a lot of people help us in the fall, because we're going to have a huge auction. A lot of you that are listening to us over the radio know that for years I did an art auction for the Alzheimer's Foundation. We're going to do the same type thing in the fall, but somebody made available to us 21 hand-tied, hand-knotted Oriental Persian rugs.
Ooh.
Those will be in the auction. We're getting art from all over the country, Indian artifacts, and Tomorrow I'll mail 5 hand-signed posters of the Super Bowl to a guy in Pennsylvania who's going to get the Patriots to sign up, even with the deflated football. It'd be a greater.
Absolutely, more publicity on that one.
Okay, that's it. We're out of time, folks. Now I want to thank you, Kay, for being here.
You bet.
And we'll see you again next week, same time, same place. Bye bye. Have a great weekend.